a strengths perspective, and strengths and coping, okay, which is different than the medical model. And so the thing is, are we going to be asked to follow a cookie cutter medical model? Or will there be openness to alternative theoretical frameworks?
I think that my response to that would be the latter, because I am reviewing NIDA's long-range plan. You got to go back and look at the long-range plan. But I think it reflects a socio-political model rather than the traditional medical model, which opens up the paradigm to employ qualitative methods. I think so. So I would say in total, in terms of the research agenda that the center will support as its fellows develop, as its fellows across the 6 minority entities and research faculty, scholars at other institutions who are not at other minority entities, who are not a part of the 6 minority entities participating in the research. If they have worthy issues that the research methods reflect a need for qualitative research, I would say that that's something that they should pursue.
Thank you.
Absolutely.
Yeah, absolutely. And let me conclude by mentioning another area. One of the things that the Research and Training Center will offer is the opportunity to work with your institution to identify its strengths, its for research, and to move forward in that process, even providing technical assistance to faculty on how to develop a research agenda and to look at the kinds of issues that were just raised in terms of research possibilities and models. And also to provide possibilities for strategic planning with your faculty to do an overall look at an agenda for your institution and moving your institution towards where it's trying to go in terms of your research process. We know that many of the institutions here have already committed themselves to heightened research activity on campus, whether it's becoming a Research One institution or something moving towards that. The point is that the RRTC is committed to working with institutions to help them to meet their goals. In your success is their success. And their success, of course, makes NIDA, the National Institute on Disability Rehabilitation Research, feel real good. And we appreciate the funding that Langston has received. We're excited about the leadership of Langston University in this, from its president all the way through the faculty and staff of the RRTC, of course, Dr. Moore being at the head of that, and all of us who are collaborating as partners and to the program will certainly give what we can in order to ensure your success. And so the many years of what we bring to the table, what the folks from Boston, the Center for Community Inclusion, and others who are engaged in this process will bring is this tremendous energy, commitment, and expertise that will serve your program as well. And with that, I will be quiet and see if there are any questions concerning the process of capacity building that we've used historically that might raise some insights for the future for the Langston program. Any thoughts before I sit down? Thank you very much.
I apologize again if I offended anyone. I have been told by my dean that sometimes I tend to be too pushy, but this also gets to our department's mission statement is focused on empowerment. And so one of the things that also concerns me is the language in the material. It is the language of barriers. That is the language of the 20th century. And the thing is that rather many of us look at powerlessness of individuals to get rehabilitation services. And in our approach to working them to get access to services is an empowerment, community lay health work approach. So that I guess I'm worried here already because of your basic definitions, your basic framework, you using the language of barriers, our mission statement at our university, or our department focuses on empowerment of Black families. And so, you know, I want to know if there is an openness to empowerment, because, you know, at Howard University, when I first went here for my PhD, I had the chair of the doctoral program smile at me and beautifully look at me, and she said, but empowerment is not a theoretical framework. And so my concern is we have a mission statement on empowerment. Would that also be something that you have? Because I've been looking through your definitions, and by the way, I really thank you for everything you have written. I will be going back to my university and using your material to empower ourselves and to help us advance a research agenda. Because all the things that you have written here are happening with us. And I'm having to fight that. And so I don't want you to think that I'm being aggressive and that I'm being nasty. I'm just looking at, do I have the necessary, is there a fit? Is what I'm thinking of, you know. And again, for us, empowerment is very important as opposed to, I was taught by Dr. Kermit Nash, who was a full professor at the University of North Carolina at Chapel Hill. He was on my dissertation committee. And one of the expressions he used, because he was an expert on sickle cell disease, and I was on some panels with him years ago, and he said that a lot of researchers are into nothing but the way. And, you know, we consider ourselves to be forward-thinking people, people who are putting together an agenda for our community, and we're not into nothing but the way. So, yes, sir.
Thank you for that comment, and I'll respond to your concern and your question. The mission of the Rehabilitation Research and Training Center is to build the research capacity of minority entities, to include HBCUs, Hispanic service institutions, and American Indian tribal colleges and universities. We have a set research and capacity building agenda that we believe is progressive, that we believe is empowering in terms of building the research skills of the faculty, scholars, the research fellows that participate within the academy, and in terms of providing technical assistance and consultation to minority entities who participate in our programs to build research capacity. So clearly the mission reflects the empowerment perspective that you're speaking about. In terms of the research barrier monograph, I suggest that you read it in its entirety. It is research, so we've asked some salient questions that have historically not been asked, not been answered by minority entity researchers themselves, who perhaps have a better understanding and are closer to the problem. That's a faculty perspective. So the research findings reflect faculty perspectives. Okay? So that's that we use the Delphi technique, 3 rounds of the Delphi technique, qualitative process, some mixed methods research as well to generate those findings. If you read the actual monograph, you will see the balance in terms of the questions asked and in terms of the thrust for understanding the issue. The major problem, as I stated in my initial speech, is that individuals with disabilities from traditionally underserved populations possess or reflect differential rehabilitation experiences. One critical factor in that is that minority entities entities such as HBCUs, Hispanic service institutions, and tribal colleges and universities have not had an opportunity to participate in disability research across the federal research agenda at the levels that we think that we need to be represented, okay? We have to identify the problem. If we don't identify the problem, we don't have an issue, we don't have a priority, we don't have a national priority. That actual study was a part of the national priority. If you go back and read the actual RFP for this research and training center, which was a national competition, if you read the RFP, then you'll see that monograph, the findings of that monograph cited in the Federal Register. Without that, so without saying that piece, certainly it made a contribution in terms of the development of that priority. But we don't have an agenda if we don't have a problem. And faculty, disability faculty, have expressed many of the barriers that they've encountered in terms of building research. But there's a balance in the monograph, in the research agenda, in that Delta Sigma Theta funded monograph. Because not only did we look at faculty scholars' perception of internal barriers within HBCU systems, but we looked externally as well, something that we don't think has ever been done. We wanted their perspectives on what barriers existed within the U.S. Department of Education, NIDER policies and systems that discourage HBCU faculty scholars from applying for research, from getting research, from participating in research. So there's clearly a balance in the monograph, which, and I'll give you some insight. Our team, we had a difficult time in terms of deciding whether to go that route, in terms of looking at some of these external policy systems, because it's the U.S. Department of Education. So we had to decide as a team, do we want to search for the truth? Or do we not want to search for the truth? Do we want to be politically savvy, or do we want to search? As researchers, I believe that one of our major obligations is searching for the truth. And so that monograph reflects an initial exploratory study. It's up, as Dr. Hopkins stated earlier, in terms of her initial research to spawn all of these great capacity building efforts. That was reviewed by one of the top researchers in disability at that time, and Brian Bolton, right, who refuted, who came up with the same findings, but interpreted the findings different. The monograph, any faculty, researcher across the nation, HBCU or not, has the same opportunity to replicate the design, because the design is reflected in the monograph, replicate the design and generate their findings, refute or even support the findings. But from our perspective, from a qualitative research perspective, those are the findings. We believe that the vision reflects an empowerment theme, and as we go out through the next 1.5 days, hopefully you will see, as we lay out some of the programs and the academy and IRBM and the like, that it is an empowerment movement. This is a movement in my perspective.
Thank you.
But if we don't have a problem, we don't have anything. That's applied research. You gotta have a problem so you can address the issue of problem. Does that respond to your question, sir?
Yes, thank you
Very
so
good.
much.
Any additional questions for Mr. Hopkins? You're good.
Our next speaker will be Dr. Perry Sanders. And Dr. Sanders is a research analyst at the Langston University Rehabilitation Research and Training Center on research and capacity building for minority entities. Dr. Sanders is a former commissioner for the Oklahoma Department of Rehabilitation Services and assistant professor in the Department of Rehabilitation Council and Disability Studies. He is himself legally blind. He worked for 23 years as a career counselor under the Workforce Investment Act, and also served as a rehabilitation teacher of the blind with the Oklahoma Department of Rehabilitation Services Division of Visual Services. He is an active tribe member of the Choctaw Indian Nation and a former SBRA consumer himself, Dr. Perry Sanders.